Hello, I'm Megan Rittmaster, registered dietitian nutritionist with Foundational Journey, and I'm just here to continue talking about nutrition during pregnancy and really focusing this time on maintaining optimal gut health. So it's really important at this time to make sure that we're feeding our body with great foods, which in turn feeds our gut bacteria and our gut health. The human intestinal microbiota is actually seeded before birth. So not only are you influencing your microbiome, but you're also influencing baby's biome at this time too. So there's actually 100 trillion bacteria that reside in the human intestinal tract, and that in and of itself is the gut microbiota. It's very essential to human metabolism and immunity, and it's also essential to our brain and our development neurologically as well. So there is this gut-brain connection that is going on, and it's a pathway that goes both ways. It's very neat, and it's crazy to think that our gut influences our brain, but our gut is actually known as the second brain too. So a little fun fact there. But during this time, our gut microbiome changes quite a bit during pregnancy. So in the first trimester, the gut bacteria is pretty similar to that of someone who is not pregnant. It's pretty similar to your normal state before pregnancy. However, going through the next two trimesters, it's really when we start to see those changes within the bacteria, and our changes actually start to represent more of an inflammatory state as well, but that's completely normal. It's supposed to happen that way. We just want to make sure that we don't become too excessive when it comes to the inflammatory state. And that's where maintaining a healthy gut bacteria, healthy gut microbiome is really beneficial. So conditions like maternal obesity, gestational diabetes, excessive gestational weight gain, or leaky gut, that can actually shift the maternal inflammatory state to more of one with excessive levels of inflammation, and that can lead to preeclampsia, can lead to fetal growth restriction, gestational diabetes if you don't have gestational diabetes, and other potential issues as well. So there are a lot of dramatic hormonal shifts that occur during the prenatal period, which isn't very surprising, but that leads to inflammatory and immune changes, and that alters the gut function and the bacterial composition during this time. So estrogen and progesterone, they increase, they impact the composition of the gut microbiome, so it actually can lead to more susceptibility to Listeria monocytogenes, and that in and of itself increases your risk for listeriosis. So, the whole don't eat deli meat, or at least, heat it up before you eat it so that you don't increase that risk of listeria. That's where that can come from. There's the dramatic changes in ovarian hormones during this time, and the postpartum period also affects gut contractility and transit. So transit time of our gut actually slows down. And this is probably an adaptive response. It allows for greater nutrient and energy harvest, so making sure that we're getting the nutrients that we need and baby is getting the nutrients as well. So there is a relationship between the gut microbiome and maternal nutritional status during this time. Specific shifts in microbial composition have been associated with maternal factors such as BMI, weight, and weight gain over pregnancy. So stress, infection, and antibiotic use during pregnancy can lead to something called gut dysbiosis, and that is an imbalance between your good gut bacteria and the bad gut bacteria. And that dysbiosis is when we're having an overabundance of that bad gut bacteria, so the ratio is out of balance between the two. And that can increase the risk of maternal and infant neurodevelopment disorders, The shifts in gut microbiome also can disturb the gut-brain axis. And so it can affect your mental health. It can affect the neurodevelopment of baby as well. And so during this time, it's really important trying not to get into that excessive inflammatory state. And by doing that, we need to make sure that we're feeding our gut properly and having optimal nutrition status. So unfortunately, the typical Western diet, which is very common here, of processed foods, excessive dietary fat, of not the good fats, and higher in sugar, which promotes excess weight gain, especially during this time, and leads to gut dysbiosis, that imbalance. And that in turn can lead to adverse maternal and child health outcomes. So making sure, that we're really not falling victim to the typical Western diet and having more of a whole foods balanced diet is what is important, because that will impact not only your microbiome for future and setting you up postpartum for healing and reducing risk of any issues, but it's also going to set baby up for better health outcomes as well. So make sure that you're including probiotic, maybe supplements or probiotic rich foods. That's going to help with introducing that good bacteria into your gut, and that's going to influence your health and make sure that we're not getting to that excessive level of inflammation. Looking at incorporating lower fat organic proteins, so beans, skinless chicken, lean beef, lentils, those are all great. Organic produce whenever possible. Organic, I know, can become expensive, and there's a lot of controversy regarding organic versus not organic produce. So it's really, how you feel about that. But making sure that you're getting in whole fruits and vegetables, the colors of the rainbow is really what we're aiming for. Including unsaturated fatty acids, so your olives, olive oil, flax seeds, chia seeds, sunflower seeds, almonds, walnuts, fatty fish, so tuna, salmon, mackerel, herring. Those are all great sources of those healthy fats, and we want to incorporate those in our diet. Looking at the whole grains and including those, so brown rice, 100% whole wheat, rye, barley, oats, those are all great too. So having optimal nutrition is going to provide us with prebiotics, which are just fermentable fiber that the gut eats at. So it's the food for our gut bacteria. And in turn, while that gut bacteria is eating at that prebiotic fiber, short chain fatty acids become a byproduct. And these are energy sources for our intestinal epithelial cells and can also help in promoting gut healing and maintaining overall health. So when we're making sure that we're having those prebiotic foods, but we also want to make sure that we're having those good gut bacteria in the gut first so that we can feed them. So consuming the probiotic rich foods like yogurts, looking for those low sugar ones. Fage is one of my favorites. Kombucha, which is just fermented black tea. Kimchi, refrigerated pickles, and sauerkraut. Those are a little higher in sodium, but they are going to have probiotics in them. Tempeh and miso are also great. And if you feel more comfortable with a supplement, really making sure that you're finding a shelf-stable supplement that has at least 15 CFUs in it, and look for ones that have multiple strains of bacteria as well. You want to have diversity in there. Probiotic and probiotic-rich foods during pregnancy has been associated with lower rates of preterm birth, gestational diabetes, preeclampsia, and other conditions as well. So during this time, our bodies are going through a lot of changes, our gut bacteria is going through a lot of changes, and it's important to make sure that we're maintaining optimal levels of healthy gut bacteria, make sure that we're feeding them great, just so that we don't have such a high risk of those complications. We want to do the best that we can to avoid those risks. So I hope that this helped and gave a little bit of information about your gut microbiome during pregnancy. And just want to say happy pregnancy, congratulations again, and visit my website, www.foundationaljourney.com. You can sign up for a free 30-minute consult with me. We can discuss some of these great things during the time, and how you can feed your body and feed baby during this time. So thank you so much.